Thank you very much, and thank you for inviting the World Health Organization to this amazing event. Special thanks to Letitia Moratti, and regards from my boss, who's the Assistant Director General for the area called Family, Women's and Children's Health. My role is to remind or talk a little bit about the interlinkages between health and positive economy and all these other aspects of development that we have touched upon in these 2 days. We've been through education, business, urbanization, art, culture, technology, finance, and health is, of course, interlinked with so many of these. Talking about interlinkages, I'm myself very excited about this because I feel like a hybrid to a certain extent, being part French, part English, part Norwegian, having worked and lived in 5 different countries, having trained both as a medical doctor but also with a public health and business degree, having started companies and now working in the UN system through the World Health Organization. So I guess my role within the World Health Organization is to try to encourage the getting together of the positive forces of the UN and WHO system with all our external partners from the private sector, from the non-governmental organizations, from the educational sector, etc., etc. So in the next few minutes, I'd like to just very briefly touch upon sort of the big picture of healthcare, what we are doing in the area of women's, children's and adolescents' health in particular, and not least then on the importance of partnerships and innovation for being able to reach the goals that we all have, which Nicholas Hodges just talked about through the Sustainable Development Goals. So starting with the big picture, there's been a tremendous amount of progress. Compared to 1990, about the rates of death for children under 5 and for mothers giving birth have been halved, roughly. That means that in 2015, last year, there were about 19,000 children who survived who would otherwise have died in 1990. So, and we've also learned, looking back, that investing in health is not just the right thing to do, it's also a very good economic investment. It's been shown that improved health has contributed significantly to the income growth in low and middle income countries. Looking forward, quite recently, there was a commission from a big international journal called The Lancet, which had a commission on investing in health, which showed that looking forward to 2035, they termed it a grand convergence is possible, bringing the mortality rates of even the low-income countries to the levels of what's seen today in the best-performing countries. So it's within our capacity and our ever-improving technical abilities to actually achieve this if we want to. And in the area of women and children's health, which I'm working in particular, my boss, Dr. Flavia Bistreo, co-led a group that developed an investment framework for that area, showed that a $5 increase per person per year in the 74 countries with the highest burden of disease and death would give 9 times that value in economic and social benefits, as well as avoiding millions of deaths annually. So health is important for development, but it's also true the other way around, of course. Looking back, we know that other sectors contributed to about half the gains seen in health so far. And so, as this forum so beautifully reflects, and the SDGs reflect, all these aspects of development are very much interdependent. The big challenge we're faced with is inequity. because there's still the fact that 5.9 million children die each year of preventable causes. 5.9 million children. Almost 300,000 women die, again, of preventable causes, giving birth or during pregnancy. And 99% of all these deaths are happening in low and middle income countries. And if we extrapolate the present development, less than 20% of countries in Africa will actually achieve the health-related Millennium Development Goals by 2030. So clearly, more needs to be done to really not leave anyone behind. And in the area of women's, children's, and adolescents' health, we, at the UN General Assembly in 2015, the Secretary General Ban Ki-moon launched the new global strategy for women's, children's, and adolescents' health. And the focus of this new strategy has been expanded compared to during the what's called the Millennium Development Goal area. So the focus now is not only on survival, but also on making sure that people thrive and that we have environments being transformed to really support health and well-being. There's also a new focus on adolescents in particular, as we've talked about earlier today, both for the health and for employment. And there's a focus on these inequalities, making sure, trying to leave no one behind, making access to quality healthcare a reality, not least in the fragile settings and fragile countries. And a final important piece of this is to ensure accountability. Now, a number of the world's nations have committed at the UN General Assembly and will at the World Health Assembly in May to supporting this global strategy. And there's now established an independent accountability panel to really follow up how this plan is implemented and will be followed up. Now, all of this requires financing, of course. And in Addis Ababa last year, there was a new financing facility, a partnership of a number of financiers and also the countries affected that have joined together into what's called the Global Financing Facility in support of every woman, every child. And this Global Financing Facility is a pathfinder to really make a shift from a donor-driven system towards domestic financing of healthcare. And a key piece of that is to use innovative financing instruments like we've heard about earlier today, particularly a focus on paying for results, as we've talked about also for San Patrignano and those kinds of therapies. To introduce social impact bonds, as we heard discussed by Valerie from the Deutsche Bank earlier today. And the private sector, through the Global Business Coalition, has come together to develop and launched the credit exchange, where private contributions can be gathered into one fund, and the fund used to pay providers for the achievement, again, of performance-based outcomes. Now, all of this will also require a lot of partnership and not least innovation. It was exciting to listen to the technology roundtable about all these developments that are happening within also healthcare. I'll just mention that healthcare is actually one of the biggest industries of the world, with today a $7 trillion annual spending. That beats oil and gas, which is at 5. It beats defense at sort of 2.5. So it's a big industry with a lot of focus. There's a dramatic development with mobile phones being available everywhere and also then using them for benefit of health. The World Health Organization is involved in a number of development of apps There are now more than 20,000 health and well-being apps around. So I think part of the challenge is to actually find out which ones are really beneficial and which ones are not. I won't go through all the developments in innovation, but just mention that areas like the sensor market is expected to grow 40% over each year over the next 5 years. A very exciting pilot is being launched in Rwanda this summer, using drones to transport blood and emergency medicines in the country. The big data revolution we've heard about earlier today. Healthcare data is going to grow dramatically. Personalized medicine, we could go on and on. But the big risk here too is inequity. Who stands to gain from all of this development? Which countries, which parts of the population? So I think one of the key roles for the World Health Organization is to guide innovations towards where the big needs are, and provide and help provide evidence of safety and efficacy, and ensure that partners commit to making innovations available to the most vulnerable populations. And I'll end up by describing one example, a concrete example of how we have worked on these aspects. And this example demonstrates also that innovations can really come from anywhere. Because this story begins in a car mechanics shop in Argentina. Jorge Odon, Argentinian car mechanic, has seen kids play with a trick where they have an empty wine bottle and they take the cork and they push it into the bottle, and then the question is, how do you get that cork out again? And that's not easy. But the trick is to take a small plastic bag, insert it into the bottle, blow a little bit of air, and when you hold it upside down and the plastic is next to the cork, you pull, and it comes out quite easily. And the reason is the lack or the reduced friction caused between the two plastic layers of that plastic bag. So he wakes up one night next to his pregnant wife and says, "Eureka, this could possibly be used to help babies when there's a need for, when there's a prolonged delivery, as we call it." And his wife says, "Go back to sleep, this is crazy." But he doesn't give up, and make a long story short, he comes to the World Health Organization, meets a colleague called Mario Merialdi, who understands that this might be one of the big innovations in the area of obstetrics since forceps was developed and the vacuum. So WHO helps to achieve some funding through an international mechanism of partners who are funding innovations within this space called Saving Lives at Birth. And a safety and feasibility study is now ongoing under the auspices of the World Health Organization. So that's one typical role, see needs, see possible solutions, and then help with both financing and the evidence generation. And furthermore, in due time, we were able to broker a deal with one of the big medical technology companies, Becton Dickinson, who now have the rights for this device, have developed the prototype further. And in the agreement between the innovator, ourselves, and Becton Dickinson has then taken on the responsibility to ensure access for the poor if this ends up being proven helpful and successful. So that's our interest, but on the other hand, we will also then help in terms of getting this to the market if the data show that it's really worthwhile. So in conclusion, I have three very simple points. On the one hand, let us remember the humanistic and economic rationale for increasing healthcare spending to ensure the development of a positive economy. We need to make sure that we maintain a focus on equity, both globally and within countries. And last but not least, we need to foster even more innovation, even more partnerships in the healthcare sector to reach our ambitious goals for the future. So thank you again for the invite. Thank you for letting WHO be part of this conversation.